This video will go through each of the subtabs on CMR and CT study pages. To begin, select a study, and on the left side you'll see a status panel. The green indicates that all the critical fields have been completed, and the red indicates that there are still more fields to be completed. There are long and short ways of entering data. The shortest way would be to go to the CMR COOP Essentials page. This page has aggregated all of the essential and critical values in the database. Otherwise, the user can go through each page individually. Let's take a look at each subtab to see what that will entail. We can begin with patient info. This page comprises the basic demographic and clinical information, such as their race, the height and weight and BSA, the fellows and physicians assigned to the patient, the protocol number, admission information, and diagnostic information. If this patient has been in other studies, the user can simply copy all fields from a previous study and select from the dropdown here. Doing so will automatically populate some of these fields with fields that have been completed in previous studies. Next up is cardiac history. This is a very simple yes or no format for risk factors and histories. For each particular history, you can indicate the date or duration. If you want, you can also set all to no if the patient has none of these risk factors or histories, or set all to unknown. The next subtab is medications. There's a separate video on this page. Please view the video entitled Medications for more details on how to use this page. The next page is labs and associated tests. On this page, you can record lab results such as the values for serum creatinine and hematocrit, as well as troponin levels, CK levels, as well as any other tests performed such as echo, nuclear, CMR, etc. This is the drugs and drug protocols page. On this page, you can specify the drug protocol for the study. So indicate the sedative used, the contrast agents used, and the stress agent used. You can also add additional drugs if you need. This is the MRI techniques page. On this page, you can indicate the MRI field strength, the scanner vendor and scanner name, as well as techniques that will be used during the study for rest, stress, and research. So the next page is resting MRI. The gray fields are automatically calculated based on values entered in preceding fields, like the calculation of stroke volume and EF. Some of the data can be converted to qualitative interpretations for variables such as LV size. So right now, LV size is described as being small, but suppose we change the LV in diastolic volume to something like 300. Now the qualitative assessment has changed, and it is described as being severely dilated. There are also fields for wall motion, perfusion, and delayed enhancement. For more investigational use, such as grading segments, the user can select these buttons. So let's select segmental perfusion. The buttons will lead you to the relevant page. There are additional subtabs for the right ventricle, which is quite similar to the one for LV, the atria, and great vessels. The next page, hemo-response, can be used for recording patients' vital signs, hemodynamic response, and any symptoms of complications that occur during the study. The grade myocardial segments page features interactive 17-segment models, allowing users to grade segments directly onto a diagram. The user is able to grade segments for stress and rest perfusion by clicking on individual segments. Clicking on the segment multiple times changes its color and grade. Alternatively, the user can right-click on the segment to see all of the grading options. The user can also use the buttons below the diagrams, for instance, indicating that all 17 or 16 segments are normal. The page also offers opportunity to record grades for dobutamine function, stress function, and viability. The T1 mapping page features 19 segment models, which allows the user to record values for T1 and blood T1. This is the pericardium and pleura page. This page is fairly straightforward and qualitative. The user can provide a rating for pericardial thickness, note whether there was a pericardial effusion, and note any other findings. Any abnormal findings will be noted on the MRI report. The heart valves page has 4 subtabs, each corresponding to a cardiac valve. The user can describe the morphology, indicate the presence of stenosis or regurgitation, and record other quantitative values. The fields across each of the 4 subtabs are quite similar. The thoracic aorta page allows for detailed descriptions and measurements of the thoracic aorta, as well as certain qualitative findings. In the next page, the user can enter non-cardiac findings identified within the lungs, the mediastinum, bone, soft tissue, and breast. On this page, the user can indicate whether there were certain complications. These are separated into 3 sections: those that may require immediate notification to the IRB, those requiring notification during protocol review, and those that are not reported to the IRB. The final page allows for the user to indicate whether there have been any changes in diagnosis using yes or no radio buttons, and whether there have been any changes in downstream procedures or any changes in medication or hospitalization. The CT study pages are identical to the MRI study pages. However, there are 3 additional subtabs in the CT pages. The first is coronary calcium. This section enables the user to record the patient's heart rate, blood pressure, as well as measurements such as the Agatston score, volume, and coronary calcium mass. There are separate subtabs for measurements made for clinical and research purposes. The program will automatically calculate the totals of each type of measurement. The next page unique to CT studies is CTA. In this page, there is space to record heart rate and blood pressure at baseline, during CTA, and at the patient's discharge. There is a table and a diagram provided to the right, which provides a reference for the scale used to grade stenosis and plaque type. Finally, there's a page for bypass graft. On this page, the user can enter the history of bypass surgery. The user can indicate the types of bypass graft and the targeted areas, as well as grade the extent of stenosis.